Time now for Restoring the Soul of Healthcare from the Help Care Clinic in Austin.
Yeah, and we are very glad to bring into the conversation, of course, here this morning, as we do every Thursday right about this time, Lee Acey and also Dr. Dave Strobel. And as mentioned, they're going to be with us here on this Thursday morning. Gentlemen, great to have you with us here today. And we were briefly talking before we came on here. I believe you were talking last week here with John about metabolic syndrome and it being the root of most deadly and feared diseases, including heart disease and stroke, diabetes, cancers, and even Alzheimer's. And you were, as mentioned, making your way through different metabolic syndromes. Is that correct? Or?
At least one element of the 5 basic elements of metabolic syndrome are present in about 90% of the U.S. population. And probably the first of those, and the one that is at the root of it, is blood sugar control. And so this time we wanted to have Dr. Strobel go into a little depth on that and talk about blood sugar and how that really affects and how it really sets the table for a lot of these other related conditions.
So the thing about blood sugar is that it's the main fuel that your cells need. And fuels are funny things because you need them to be able to run stuff. But if you get too much of it, that causes problems too. So fuels are simultaneously essential and poisonous. So just an analogy is if you don't put gasoline in your lawnmower, it's not going to work. But if you put too much gasoline in your lawnmower, it's not going to work. And glucose, blood sugar is the same way. So your cells need blood sugar, but if too much gets into them, it's going to poison them. And so the way that is controlled is by asking your cells, do you need blood sugar or not? Do you need fuel or not? And the messenger that asks is called insulin, which is a hormone that's made by the beta cells of your pancreas. And insulin's job basically is to knock on the door, the delivery door of the cell, and say, I got a shipment of fuel here, glucose, do you need any? And so then there's a doorkeeper on the other side of the door, and he recognizes the knock and knows there's a glucose shipment, and he looks over at the guy that is monitoring the fuel bucket for the motor in the cell and asks him, how are we doing for fuel? And that guy then tells the doorkeeper, here's what we need, or here's what we don't need. And if they don't need any fuel, then the doorkeeper just leaves the door shut, and insulin goes and knocks on somebody else's door. If the fuel in the cell is getting a little low, engineer at the motor says, yeah, we could use a little bit, and then the doorkeeper opens the cell door, and in comes glucose and fills up the fuel tank, and the cell doesn't get poisoned, but it does get the fuel that it needs. So that's basically how that works. And what goes on with the metabolic syndrome is there's some problems with that system. But the thing that happens with blood sugar control is one of 2 basic things. One is maybe there's something wrong with insulin. And so if you don't have enough insulin, if you have a deficiency of insulin, your pancreas isn't making enough of it, then there's nobody knocking. And if there's nobody knocking, then your cell doesn't know whether there's a shipment of fuel or not. And so the doorkeeper says, gee whiz, I haven't gotten a knock for a long time. And the fuel bucket is getting low, and the engineer is yelling at the doorkeeper and saying, I need some fuel. And the doorkeeper says, I'll let you know when we get a shipment. And meanwhile, out on the loading dock, there's a huge shipment of fuel, but nobody's telling the cell. So the cell is starving, basically. It's getting low on fuel and isn't doing very well. And the whole problem is that nobody's knocking. And that usually is pretty significant. So the blood sugar is really high in those cases. And that's called type 1 diabetes mellitus, or type 1 diabetes. And that's a pretty uncommon form of that. Some folks will say that represents about 5% of diabetes. I have a hard time believing that. I think it's got to be a lower percentage than that. But the other kind of diabetes is type 2 diabetes. And the mechanism of that is a little bit different. And that's the one that the metabolic syndrome deals with. And so that one, the doorkeeper is becoming deaf. And insulin is knocking on the door, but the doorkeeper really doesn't listen to it very good because he can't hear the knock. So insulin needs to get some more of its buddies to come and knock on the door louder. And so the insulin level goes up. And as long as enough insulin is made to get the attention of the doorkeeper, then he's going to open the door and the blood sugar is going to come in and it won't be outside the normal range. And the cell will do okay. It's just that you have to make more insulin in order to accomplish the same thing. And that's called insulin resistance. And the problem is that at some point, the pancreas is not able to keep up with the demand because the doorkeeper gets more and more deaf. And when he gets deaf enough, then the insulin that's being made is basically at its maximum level. And now, as his deafness increases, now there can't be any more insulin made. And so now the blood sugars start sliding up. And so then you start seeing high blood sugars, and eventually, if that gets high enough, then we arbitrarily say, now you have diabetes, and that's type 2 diabetes. But there's a hugely long period of time way before that when the blood sugar is normal, but the insulin level is higher than you expect, and that goes on for a long time usually. And then the blood sugar goes up into the abnormal range, and the insulin level doesn't go up any higher, and that gets referred to as prediabetes. I don't like that term at all, but that's not controlled blood sugar. And then as that happens, now what happens, the cells that make insulin start getting poisoned, and they actually make less and less insulin when more and more is needed, and now the blood sugar really goes up, and now you got out-of-control problems, which is type 2 diabetes. So detecting it at an earlier point when the insulin level is high but the blood sugar is controlled is really an important thing. But unfortunately, insulin levels are often not checked, and they're often not listened to. Like, they're in the normal range, but the normal range on the lab is totally wrong. And so somebody will see your insulin level is normal, but it's also 3 times too high, and you should do something about it, and nobody does anything about it. So even when it is checked, a lot of times the right action isn't taken. So that makes it a little complicated.
So where does the insulin resistance come from? Why is it that the doorkeeper gets deaf over time?
From a simple standpoint, the cause of that is the high carbohydrate diet that we eat. Carbohydrates are either sugars, those are called simple carbohydrates, or starches, which are complex carbohydrates. And remember that a lot of carbohydrates that we eat are actually in liquid form. So high fructose corn syrup in pop or beer, that kind of thing, those are sources of either starch or sugars, and those are carbs too. So all of those things are carbs. People sometimes think, I'm cutting down on my sugars and my carbs. That's not the right view. You cut down on your carbs by cutting down on sugars and starches. And people think that carbs means starches like bread and pasta and potatoes and things like that, and then sugars are a separate thing. No, they're all carbohydrates. So that kind of forms the kindling that is the main source of blood sugar from food. And so when we eat a diet that's high in carbohydrates, what ends up happening is we increase the blood sugar too much. We give too much for the pancreas to do, and it ends up trying to manage this. And then that starts the whole cascade of all the other stuff that goes wrong in the metabolic syndrome. But this is a central thing that really starts it all off. It's our high-carb diet, which is really quite toxic.
Great, yeah, and I think in next week we can start to get into some of the other elements of metabolic syndrome, but I think that kind of points out part of the value of what we're offering through a healthcare clinic is the labs that are needed to be able to diagnose metabolic syndrome are included in the membership. at no extra charge. So you're able to really monitor and dig down and get at what's happening with the members, and be able to then give them advice and coaching and support for those who are interested in making some lifestyle changes.
Yep, that's exactly right. You can prevent all this.
And the other thing I wanted to highlight is that we are in our early bird phase of membership, where it's 20% off what the regular dues will be starting sometime later this summer. But we're at $19 a month for a single, $199 a month for a couple, or $279 for a family, and that includes unhurried primary care as well as then more timely care as people get sick or have the needs. But then about 45 of the most common blood tests that are typically required, including the fasting insulin and fasting glucose levels, which are required to be able to diagnose insulin resistance and to see where the problem's starting. And then starting in June, we'll be having many common medications will be included in the dispensary, many of the generic medication, both for convenience and for savings on cost. So I just encourage people to give us a call at 279-2345 or stop by and see us at 308 4th Avenue Northwest, which is just a block east of St. Augustine's. And we're open from 8 to 5, Monday through Friday, or 8 to noon on Saturday. So if you want to stop in for a tour, we can show you around and tell people more what we have to offer at Healthcare Clinic.
All right. Well, sounds great, Lee. Again, Lee Acey, and again, Dr. Dave Strobel. And Dr. Dave, just real quick, myself afflicted with type 2 diabetes, and I guess for those that may be unfamiliar in the audience or wondering, in terms of some illnesses are hereditary in a family, and does that go for more of type 1 diabetes, or can that be true for type 2 diabetes?
It's more true for type 2. However, the difficulty is that most of the time it said this is a hereditary thing, and all the rest of the contribution to it is disregarded. And even though it's got a hereditary component, the vast majority of people who say, I've got it because my family has it, the vast majority of those folks really have it because of lifestyle stuff. And even with the hereditary stuff, it still is preventable and largely reversible in many cases, and certainly controllable with lifestyle change.
Sure. And as you guys have been talking about, you obviously can help our listeners with that. Again, stop into your clinic at 308 4th Avenue Northwest in Austin. And gentlemen, fantastic information for us here today on KUS. Again, restoring the soul of healthcare. Again, Lee Acey and Dr. Dave Strobel at their clinic in Austin. Gentlemen, thanks for your time here today. Like I said, great information, and looking forward to another great conversation here next week.